Welcome everyone to the regular town hall around COVID-19, co-hosted by the Utah League of Cities and Towns and the Utah Association of Counties. I'm Cameron Dill, the Executive Director of the League, and joined by Brandy Grace, the CEO of the Association of Counties. Brandy, long time no see.
It's been a little while, hasn't it?
Yeah. We were commenting just as we were in the waiting room to get started that we're going on almost 3 months to the day since our first town hall, and the world continues to go faster than any of us can run. But we are in a fortunate spot here in Utah compared to other states, and certainly you look back, Brandy, on where we were 3 months ago and the amount of panic and anxiety that was out there at the city, county, and state level. And ultimately, I think we have to feel pretty good about where we're at.
A little bit of a blindside. It was just the conclusion of the legislative session, and then wham, like a Mack truck.
So am I in?
That's exactly right. That's exactly right. Yep, Senator, you are in. So we are thrilled today to be joined at 3:30 by the Lieutenant Governor, and before the Lieutenant Governor, to be joined by Senator Jerry Stevenson, who is the Senate Chair of the Executive Appropriations Committee, and Representative Jefferson Moss, who is the Vice Chair on the House side of the Executive Appropriations Committee. But more important than those titles, they are both former city leaders, Representative Moss being a former council member in Saratoga Springs and Senator Stevenson being a former mayor of Layton. So Brandy, with all due respect to the counties, we're happy to have some city folks join us today.
We love them.
So Senator and Representative, thanks for joining us. We'll start with you, Senator Stevenson. Walk us through what's going on with the state budget and what city and county leaders around the state need to know.
Well, thank you very much to begin with. It's a pleasure to be here. It's kind of like old home week, so I appreciate the opportunity to be here with you. First of all, the budget we have got, it's really kind of a pretty topsy-turvy going on right now. And the reason is that we just don't know exactly what we're dealing with as far as revenue is concerned. We're looking at revenue, low estimates in the 200 million range to high estimates of 1.5 billion. And as a result, it's really hard to know where to go in to come up with a budget. As you know, a lot of what took place was caused by when President Trump moved the tax effective date from the 15th of April to the 15th of July. And our closeout date for the year happens to sit right in the middle of that. And so that's the issue that we're dealing with as a state right now, is trying to figure out what we need to have a balanced budget. As you know, we sent out the notes to all of the departments that said, show us what a 2%, a 5%, a 10% cut looks like. We have looked at those very closely, and Jefferson, you could certainly chime in here anytime you'd like, but as we've looked at these, we'd like to do this a little different than we did last time, and then that was back in the 2008 recession. And we went in and we kind of did a chop with an axe. That's a really hard thing to do. We'd like to make this as surgical as possible. We think there are things that we don't want to get involved in cutting. And we certainly don't want to cut any cash cows. We don't want to cut anything that is bringing revenue into the state on a regular basis. And unfortunately, the best example I can think of that is probably a DABC store. Back in the 08 series, when we went in to do cuts, we literally closed some stores. That doesn't make a lot of sense from a business standpoint. Now, maybe from other standpoints it does, but from a business standpoint, that does not make a lot of sense. The other thing we don't want to do is we think that our future is probably going to be there's going to be a lot of people that are going to need to be retrained as we go through this process. So we don't want to cut things that are going to retrain or are very constant in our system right now. So that's something we want to get into and look at very closely. The other thing is there's just a high demand for social services. We all recognize the importance of education and how to take care of that as we've gone through this process. I will say our university has been amazing to work with. They said, look, we'll allow us to be part of the retraining. Then to make this more complicated, we've got all this COVID money that it's going to be very hard to figure out exactly how to spend that And I'm sure you as cities and counties are caught up in that, because we don't want to be in a position to where we're going to have to pay any of that back when we get finished because we spent it wrong. And so, with that, that's kind of an entryway into, we'll get us started here. And maybe Jefferson, and we've got a wonderful legislative appropriations team with Brad Last in the House and Jefferson, and then with Don Epson and myself in the Senate. We work amazing. We've got amazing people that run our ledge analyst office for us, and we get the right numbers. But it's just really hard this time. Andrea Wilco has been able to estimate our revenues of the last 2 or 3 years within just to get us down to tiny percentages, and we just can't do that right now. We don't know what the sales tax impact is going to be. When you look at many businesses have been shut down, we're looking at a very weak sales tax report. And yet it did not look that bad in March, but a lot of businesses were not closed in March, or they were trying to do different things. There are certain segments of our economy that have done very well through the process we've gone through the last few months, and they've actually exceeded in sales. This would have been a great time to have had sales tax on food in place. So, just that was a dig. I don't know who it dug, but that was a dig. So, but I think maybe we'll hear what Jefferson has to say on this, and then we can certainly come back. If this is a panel, I'd be more than happy to chime in where you want me.
Yeah, thank you, Senator. Yeah, I was on the city council when we went through our last recession, and I probably shared this before, but I mean, we were a very young, fast-growing city. We were dependent on the wrong source of revenue. We hadn't raised property taxes since the beginning of our city. And when we went through that last recession, we cut about 30% of our budget and had to raise property taxes 116% in 2008. So if you can imagine, I was not a popular person, nor were any of us on the city council. I will say, coming into this situation as a new member of Executive Probes, I'm still fairly new in the legislature. I'm just finishing my second term. I am so grateful for our leadership and Senator Stevenson and others who have done such a great job of preparing our state for this. We've done a number of things, setting aside working rainy day funds, doing projects that we knew if we needed to, we could pull back and do bonding for. And so, I think we're in a much better place, and it's still going to be painful, but it's going to be much better than what I think many of our neighboring states are going to go through, in large part because of our leadership that's done such a great job over the last few years preparing us for that. So, I don't have anything to add other than I understand the challenges at the local level. I understand that you're very dependent on certain types of revenue, and we are in unique times with the way that COVID. I mean, what a weird thing where we just shut down businesses and told people don't go out. I mean, I've done investments for 20 years, and how do you manage to that, right? It's just crazy that you just have this literal shutdown of an economy. So anyway, hopefully, as I was saying on the call before, Utah's positioned, I think, very well to come out of this. We already had a great economy before, and I'm hopeful that things come out. But it's going to be a little challenging, but I think we're in a fairly good place. So anyway, I'm open to questions along with Senator Stevenson.
Randy, take it away.
I go, Cam. Thank you, Cameron. So obviously, our counties are very concerned about reduced revenue from sales tax, potentially gas tax, projects that they had already anticipated that may have to be put on hold. And there's just a lot of uncertainty about that. But specifically, I'm hoping that you might be able to address any thoughts on contract for county jail inmate funding. That's been a priority for several of our counties, and there's certainly a concern about that. Any thoughts that you can share on that?
Well, as we've gone through the budget to date, this is Senator Stevenson. As we've gone through the budget to date, we have made a few cuts to contracts. But remember, when we started this budget process, the one thing that we did was we went back and we said, as of January the 25th, or with the base budget that we had, don't expect any revenue, any additional revenue from that point. And so we've gone back and looked at a lot of things in the budget, and we haven't had any, I don't believe there's any place where we've looked at 10% cuts yet. There are a few we've got up close to 5, and there were quite a few things that have been offered up in the 2 range. But there are some that, social services, which your counties are very involved in. We're just seeing such a demand for social services. That's going to be a very difficult place to do any cuts. But your jail contracting is an area that we have looked at making some slight reductions, and we're not looking at trying to share the wealth here. We're trying to cut down on the misery a little bit. We would hope that we get back in time so we can get back into a more normal budgeting process, get our economy back on track. Just very quickly, I sat in a meeting the other day. I was in my office all by myself on a web meeting. I started writing down segments or pieces of our economy that I think are going to suffer drastically and be a long time coming back. And if you go in and look at, just for instance, take the oil and gas industry, that isn't going to come back until airplanes start flying again, until tourism comes back. And so we look at all the ties to that. And you're right, sales tax, road taxes. Fuel tax, I think you'll find for March is going to be, I think we've already seen those numbers, but it's way down. And I don't think it'll be very much up. I won't look much brighter for the month of April. So there are lots of places, but we've tried to be very surgical in what we've done. We've tried not to do our cuts with a meat cleaver or with an axe. We've tried to use a scalpel. So that may not answer your question real well, and maybe Jefferson could add to that. But we do have some issues, and we're going to have to cut some places.
Yeah, I don't really have anything to add other than just what Senator Stevenson has said. Is there's definitely going to be some pain. We understand that, and we're just hoping we can get the economy opened up, get people back to work. Hopefully, that'll help bring some of those revenues back where they need to be.
You both mentioned wanting to be nuanced and targeted with where you're doing the cuts because of the impacts you're seeing on the revenue side. From city level, very concerned about sales tax, ditto with the counties, very concerned about motor fuel tax, ditto with the counties. We've done some analysis about where we think things will end up with the fourth quarter on the sales tax and when we think the rebound will start. Representative Moss, you referenced how Utah's better positioned than other states. Do you have a sense of where you think the economic rebound for motor fuel tax and sales tax will begin, or is it still too early to tell from your perspective as you're working through the budget?
I mean, I think we're still waiting on revenue numbers. This is such a unique time. Normally, you could do somewhat of a trend line and say, well, this is kind of generally where we're headed. I think we're getting, Jerry, I believe we're getting revenue numbers next week. We'll have a decent sense of kind of where things are now. But in terms of when we will see a full recovery, I don't know if we've had any kind of projections on that. And maybe Senator Stevenson has more on that.
We should have some revenue numbers by the 15th next week. We'll have a new sales tax report. We do know that there are some industries and some businesses that have survived this very well and actually seen large increases. I was talking to a sporting goods store the other day. They've sold a record number of pool tables. I think boat sales have been pretty good. Anything that's quite related to the family. Some car dealers that are doing a lot of internet work are claiming that they've had a lot of sales. I know the industry I'm in, the garden business, has been very good. And there's a lot of good things, but they will not offset the shutting down of all our restaurants. My wife and I, we're starting to suffer from too much togetherness. I think we're in kind of a position to where we're compressed to the point, and buying groceries is we really enjoy dining out, and we haven't done much of that the last month and a half. So I think there are going to be a lot of good sides of the report that comes in, but there will be a lot of bad. We're definitely going to be looking at a downturn in sales tax it could be maybe very drastic. And it isn't going to come back fast. I got off the phone just a few minutes ago with our recreation, the lobby people who work for recreation. And, you know, I do believe we'll see a lot of uptick, but it depends on whether people decide to go camping and take their camp stove and a cooler full of food, or whether they decide to go and stay in a hotel and at one of our, adjacent to one of our state parks or national parks. It's totally tied to the spending and how we spend. I was in St. George last weekend and what is it, Pine? Anyway, the big state park down there up above Ivans up in that area it was just packed. Sunday morning, I think a lot of people had gone there for church service or something. But they weren't spending anything. And then we've got to have people who've got to spend in order to bring this economy back.
And add into that, Senator, I was down in Moab actually last weekend. We're getting a lot of in-state and local, but you think about the international tourism and how much of an effect that's going to have on our states, and how many of them are coming and paying gas taxes, right? They're coming from out of state and traveling. So, you know, it's going to be a while till we see that influx back of a lot of these international travelers.
I think that goes back to these airplanes have got to be flying. I think they're going to be bringing people to us, but it's going to be a slow comeback. We're going to be talking about this for quite a while, I'm afraid. And I think we're looking at some reduced budgets. Those of you that are in great, and I know there are a lot of cities and counties that have done a really good job of keeping their house in order and have balanced budgets, and I think that's real important. And certainly some belt tightening is going to help all of us.
I have basically a two-part question, and this has to do with reserve funds, fund balance, and use of those funds. Specifically, I'd like to talk about TRT funds, where counties are able to keep some of that in reserves, but the use of those funds is limited to a good portion of it towards marketing. And in this situation where it wouldn't have made sense, there was no marketing that needed to be done because you're not encouraging people to come to a place that you've essentially shut down. We had requests from members wanting to be able to use those funds to help those businesses that were so hard hit by the lack of tourism going on at that time. So that's the one question I have, is the use of those funds. The second question has to do with fund balance, where counties are limited on fund balance that they can carry over. What have we learned from this experience, and is there any appetite going forward to maybe look again at those reserve balances and intended uses in the future for what that may be able to be used for, or increasing fund balances to respond to situations such as this?
And before you answer that question, let me just piggyback and say that state law has a cap on the amount of money that cities and counties can put in those rainy day accounts. It was last adjusted actually after the last recession. It was adjusted upward to provide more flexibility, and that's certainly something we're hearing on the city side too, is wanting to revisit those rainy day camps.
Well, it's having served as a mayor and knowing what those caps can do and what they can do for you if you have them in place. I really believe that we will probably revisit that. Let me just tell you very quickly, we're moving in, we'll have a special session, right, coming up here very quickly. In that special session, there are certain things that rise to the top of a special session that become special session material, if you will. Everyone wants their bill to be looked at in that process. But some of these will have to wait, and I think we're going to have several special sessions between now and they will most likely all be tied to budgets as we go through this process, because we are taking almost a worst case scenario to try to fix the budget for June 30th. And then we will move into, and some of that, if our scenario, if we've overplayed our hand, then we will look at different scenario and probably reinstating a lot of things in the next round. If we haven't, then we'll look at additional cuts and additional things that we'll take to balance this budget. But we also realize that we have a lot of political subdivisions we work with. We've got to make it work for you too. If it doesn't work at the city county level, it probably isn't going to work very well at the state level. I've said this: you deal with all the services where the rubber meets the road. We kind of deal with the next level most of the time. So I think as elected officials, we've got to do what we have to do to make sure that you can use those funds. We have that flexibility, that money that you have sitting in reserve, that should be part of your working rainy day fund like what we have. Let me make one quick statement on the rainy day fund. I don't know how much time we've got here, but I'd like Jefferson to take a little more. But we've looked at, a lot of people, I've been getting a lot of texts that said we have $5.4 billion in rainy day money. That is not true. We have just a shade over $1 billion in rainy day, and it's spread out between Medicaid, education, and general fund. And education being about 60% of that. So that the thing that we're concerned about, we don't want people to have misconcerns, but if we had $5.4 billion in rainy day money, we all ought to be elected out of office or kicked out of office, because we shouldn't take taxpayer money and hoard it. And with $5.4 billion, that's what we have. $5.4 billion is the amount of the total education fund for the state of Utah for last year. So there's a lot of confusion on that. So I would hope we can get that out there, that we have about $1 billion. And we think that money, or some of us think that money, and there's some folks think we should use that as a balancing effort right now, but we were 8-10 years getting that all put together. And we need to be very careful about not spending that on the front end of this, because we're going to have it a little later on. And we've got other methods in short-term rainy day that we're using, which is bonding. We've bonded for the prison. We've been paying cash for the prison. Well, now we can bond for the prison, put it on payments, and then put that cash back into our system right now when we need it. We can do the same thing with some of our other buildings that we've been working on. We took all the buildings out of the budget for last year that we approved in March. So those are some of the kind of things that we're doing. But there's rainy day money there, but that fund that you've accumulated, in my mind, should be part of your working rainy day fund. We'll need to get some legislation in place to loosen up on that so you can use that money. I hope that answers or helps answer the question, at least from my standpoint.
And I would just add, I've only been a legislator for a short time, but I served on the city council for 4 years and the board before that. We're always reevaluating, right? When you talked about the caps and different things, there's obviously purposes of why those were put in place, probably some good discussion. As we look through this recession, we may be able to say, or this downturn that we're currently in, maybe we need to reevaluate some of those things. I think that's a great topic of conversation. And I think legislators are always open to looking at different approaches and getting new information and saying, maybe that wasn't the right level. We don't know, right? So that would be worth having a conversation. To Jerry's point, I do think there's a concern if you have too much of a rainy day, right? Which we've been doing. We've been trying to cap out our rainy day funds. At a certain point, though, you don't want to tax your citizens more than is necessary. And so we're trying to walk that balance of putting enough aside and trying to be fiscally responsible as we manage those funds. And we've been, for the last couple of years that I've been in the legislature, doing things like Jerry's mentioned, working rainy day funds, looking, kind of preparing for, right? We're at the end of the longest bull market in history. Well, this can't last forever. We didn't expect the pandemic, but I think all of us probably were seeing on the horizon, there was likely going to be some kind of a downturn. And I think we need to be fiscally responsible in preparing for that, maybe looking at not spending as much and pull some of that back in preparation for some of those down years. But in terms of looking at different mechanisms, I think we'd be open. I'm sure legislators would be happy to have the conversation.
And Cam, if it's okay, can I just follow up?
Fire away.
Thank you. Additionally, on the question related to limited use of funding for specifically TRT, I was in Vernal last night for actually the gubernatorial event, but happened to have a conversation with the tourism director out there where she shared with me the real concerns they have for the hotels in that county and the challenge that they had to even bring those hotels and those businesses back after the recession and now to be hit yet again, it would really be nice if there could be some flexibility, even for a period of time, to utilize those TRT reserve funds to help those businesses. It's not, just about today, but even future events that those communities may or may not be able to have based on capacity and hotels that exist in those communities. It's so important, and we certainly want to make sure that those businesses are stable and able to continue on and make it through this.
Well, certainly that's a place we can go. Is there are reserves there that we could use or could allow communities to use. But you're absolutely right. The opposite. I remember being in Vernal one night, and a guy by the name of Gary Herbert, who was lieutenant governor at the time, was staying out there the same night, and he got up the next morning, and he kind of looked like Cam. He hadn't shaved very well, and I said, "Where have you been?" And he says, "Well, I didn't communicate well with my staff. They didn't know we were coming out here last night. I finally found a room, and there's only two things I like about or that I demand of a hotel room. That's clean beds and hot water. And last night I only got half of that." So anyway, it was, but this was during the oil boom out there, and they were literally, if you weren't checked into your hotel or they didn't have a credit card number by 2 o'clock, you couldn't get in. They would just sell it to someone else. But it's this is bust and that was boom. And but I do believe that if any funds that we have right now, we should be, number one, dedicated to put them back after we spend them, but number two, spend them as wisely as we can to make sure people can stay in business and we can keep our economy going.
Well, the last question that I have for the two of you, and I'm honored that I looked like the governor looks like me at some point. But the last question I have for you is around transportation funding. One of the biggest partnerships between the state government and local government, city and county alike, is around transportation funding. So what are the tactics that the legislature is planning to use to shore up transportation funding or still invest in transportation funding or transportation projects in the short term and the medium term?
Okay, Jefferson, I've kind of taken a lot of time here. I can either go with this or you can go with it.
You're good. Go for it.
Thank you. Well, first of all, let me tell you a little bit about transportation funding. The state of Utah during the last downturn, we went on a bonding. We shifted our bonding. We went to almost 80% of our capacity. With the letting of the prison bonds and a transportation bond that had already been authorized last session, we have shifted ourselves. We are at 51% right now, I think. And so we've got a long ways to go. Now, we'll require the legislature to continue to move that bonding limit up, but we're a long ways from bonding as far as we can go. But we do need to keep transportation projects moving forward. The other thing that I think we need to consider is that during the last downturn, we used our bonding capacity as an economic stimulus package by building roads and by building buildings on campuses and so forth. So if the unemployment continues and stays down, but the difference right now is that our unemployment is not in the construction industry. It's not in that segment of our economy. So we want to watch this very closely, and if we get out here another 90 days, we're starting to get indications that may be a time that we want to start bonding and putting money back into transportation. But I don't think we've done anything with transportation yet, except we did have the capacity to, we had already authorized those bonds. They were some that we paid off early last year. And so that capacity, in order to keep transportation going, we authorized those bonds. They have not used the money, but they have been let at a whopping 1.13% was the interest rate that we paid. I don't think we could get that interest rate today if we put bonds up, but that's what we have, the prison bond, and that's what we have, the transportation bond that we authorized in the last special session. So your answer to transportation is, this is a great time to take care of it if we can find the capacity and the money to do it. This is a good time we get good value for our dollars in transportation projects. That's everybody.
Perfect.
You know, Jefferson and I, we spent a lot of time just looking at each other across screens. And
I learned a lot from Senator Stevenson. He's a very wise man.
Well, thank you both for joining us. Any final thoughts about what people need to know about next week's special session and beyond before we pivot to the Lieutenant Governor?
I can think of, you know, other than we're just working as hard as we can to try and make this as surgical as possible. Right now, we're making a real effort not to cut jobs. We think that we can tighten up on some programs, but we really don't want to have to turn this into a let people go. Our unemployment rate does not need any kind of a nudge upward. So to date, we've done a really good job of that with all the recommendations we've made. And but this is an ongoing process, and especially where we have as many unknowns as we have, we'll move forward. But there's a lot of things out there we don't know, and I'm sure it will require other sessions to fix. So thank you very much for having us today. I'd like to stick around and talk to Lieutenant Governor. Him and I are great friends. He's a good guy. I really enjoy working.
I'd love to give Jerry the next 25 minutes.
Oh, well,
Nice. Well played.
Thanks for having us. I'll let you go.
thank you.
Perfect. Well, thank you both. And Lieutenant Governor, welcome back. Early in the call, Brandy and I were chatting that we are coming up on 3 months now of regular town hall conversations. So thank you for all the time that you've dedicated to city and county leaders over that period of time. So what great updates do you want to start with around where we're at COVID-19 wise around the state, with one obvious update, and that is that we're going to have some Jazz basketball here in a few weeks.
We are indeed, and it's just another symbol, I guess, that we're moving back towards normal. Although there's not much normal about what's going to happen there. Of course, the teams will be sequestered to Disney World to play some regular season games and then the playoffs. But anything to take our minds off what's going on now, I think will be good. I appreciate the opportunity to be with you again. Thank you for this conversation that we've been having over the past few months. I mentioned this before. I mentioned it last night. I think that we found something here. I think it's important. We always talk about communication. The governor says this all the time, that our biggest problem in government, really our biggest problem in life, most of the problems that happen in our lives are because of a failure to communicate. We communicate wrong, or we communicate poorly, or we don't communicate at all. And this, we've always talked about how could we do this better? And suddenly we have this tool that allows us to do this better. And I don't see why we don't need to do them every week, but why these conversations can't keep happening on a regular basis. I also love that we've been able to have the executive directors of both of these organizations. As I've mentioned it, you've become kind of quasi cabinet members in a way, in that you are involved in many of the discussions that are happening. You're able to add context and of course communicate back to your membership what's happening. And so as one of the I guess one of the few silver linings or fortuitous circumstances that have come out of the coronavirus, I believe this is one. So let's not let this momentum slip away as we get on top of things. I would prefer to keep it going. I will say though, of course, you all have followed this very closely. There have been some concerning numbers when it comes to the coronavirus. We have seen by far the highest numbers of positive tests throughout the course of this disease over the past week, and not just the highest rate or the highest number of positive tests, but also the highest rate of positive tests, and that's also concerning. We have been one of the lowest in the country when it comes to positive tests versus overall tests. And the last week we've been one of the higher states in the country for that. We had a day where we were up around 20%. We've been averaging over the past 7 days about 10%. To the past couple days have lowered down again, which is good news, but certainly concerning. Now, positive test rates aren't concerning in and of themselves. They have to be taken in conjunction with everything that else that's going on. If they're if they're low risk people that are getting infected, that's it's not ideal, but it's not that problematic. It's more concerning when it's those over the age of 65 or those with underlying comorbidities. We don't have enough data right now to know for sure if that's the case. That we're doing a better job of protecting those that are at risk. And also much more concerning than the number of positives are the number of people that are being hospitalized and those going into ICUs. Now, the problem with that number is that there is a lag of that. Right now in the state of Utah, the average person who ends up in the hospital, it's about 7 days after a positive test. So some of these really high numbers, we don't expect to see them hospitalized until approximately 7 days later, and that's something that we are watching closely. If you want to do the math in your head, at least here in Utah, throughout the course of this disease, about 8% of people that are infected end up in the hospital. And so we're kind of seeing the leading edge of those hospitalizations. They have risen a little bit, but not as much yet as expected. So we've got our fingers crossed there. But it's something that we're watching very closely. Again, we just want to encourage people. We really can stop the spread of this if we will wear masks when we can't social distance otherwise. Being outside is better than being inside. Just hygiene, washing your hands, and of course, if you're sick at all, please do not go to work. Maybe one quick update on that. You probably saw a headline from the World Health Organization saying that there is very little example of asymptomatic spread in the world, and this has caused all sorts of problems because we started out saying, hey, there's no asymptomatic spread, and then for 2 months everyone's been saying, no, just kidding, there is asymptomatic spread, and that's making it very difficult. And now people are saying, well, who do we trust? What's right and what's wrong? Unfortunately, as with most things that the World Health Organization has done, their communications are terrible. What they're saying is that there's little evidence of people who never show symptoms of the disease spreading the disease. However, there is pre-symptomatic spread, which is a term I had never heard of, even though I feel like I've been taught by several epidemiologists. I should be able to get a master's degree at least in epidemiology right now. And no one had ever talked about pre-symptomatic spread. They also refer to that as asymptomatic spread. So with this disease, basically 2 days before you start showing symptoms, if you're somebody who's going to show symptoms, you are very contagious. In fact, many of the deaths that we've seen in our long-term care facilities have come from usually employees who are pre-symptomatic. So they were there as soon as they showed symptoms, they stopped going in, but it was too late. Unfortunately, they had already been spreading. And so we just call that asymptomatic. The problem is you don't know if you're asymptomatic or pre-symptomatic until you get symptoms, and then it's too late. So that data they shared was really not that helpful, and it just caused a lot of confusion for people. But that's what we've been told by the experts. So hopefully that's helpful. And I know we've got about 15 minutes, and I'm happy to answer questions.
Lieutenant Governor, thank you. To your point, I do want to say thank you so much for your commitment through this entire process to routinely participate in these calls. It's been very much appreciated, and going forward as things hopefully slow down and we kind of are able to focus on other areas that are of importance to us as well, we welcome the opportunity to continue dialogue with you, and just really, really appreciate your time commitment to county and city officials. I just want to say that first and foremost. As I think we've talked about on this call before, I serve on the Public Health and Economic Emergency Commission, and one of the things that we've been looking at more closely over the past week or so is the number of emergency room visits that have increased that are relative to other health conditions. And I think what we're recognizing now is there's more of a trend of people delaying seeking medical assistance for other conditions until, you know, they're in an emergency state that otherwise maybe could have been dealt with ahead of time. Is there any insight that you can give to our members relative to that specific issue?
Absolutely, Brandy, and this is where we really need your help. I've been saying this everywhere I can, and I'm so glad that you brought it up because I don't think I've said it on this call. It is deeply concerning. What's happening, and we're trying to really understand this. Of course, there was a period where because we didn't have access to personal protective equipment for our frontline workers, that it was really important that we limit, and building out hospital capacity and all of those things, that we limited people specifically from elective surgeries. But that was it. And unfortunately, because people, I think, are worried, maybe two things, at least from what we're hearing. People are worried that they might expose themselves to the disease by going to their healthcare provider. So that's one. And two, you know, they just think, well, I don't want to be a burden in some way. And so they're hesitating to go when they are showing symptoms, or maybe just for routine checkups or other things that they would have normally done in the course of their regular lives before the coronavirus hit. And this is exactly what is happening. And we're seeing it especially with strokes and heart attacks, where people may have some symptoms, but they're hesitating to go. And there is absolutely no reason to hesitate to seek medical care at all. None whatsoever. Because over the month of March and April, our healthcare systems were able, all of them, the clinics and others, were able to set things up so that if you do have symptoms of coronavirus, they can deal with you apart from other people that are coming in to get medical procedures done. And so it really is a safe place to go now. There is no reason whatsoever to delay any medical procedures or again, getting medical care. So I would just encourage people in your spheres of influence to please let everyone know that if they just want to go get a physical, if they're feeling a little off, or they're having some chest pain, or whatever that is, don't delay. Do what you would have done back in February, and go see your doctor. They're ready for you. They have plenty of capacity, and they're anxious to take care of whatever is coming. We don't want the medical outcomes to be worse because of the coronavirus than they actually absolutely have to be.
Lieutenant Governor, I have a two-part question for you that deals with the state's short-term plans and long-term plans. The governor's current order expires this Friday. Most of the state is in yellow, though Salt Lake City, Bluff, and Mexican Hat are still orange. What can you tell us about what the current thought process is about post-Friday? And then that's the short-term question of what to expect as June continues. And then the long-term question is, what is the state doing to prepare, and what words of advice do you have for cities and counties to prepare for the potential of a spike later this year? Yes, we had cooler weather over the weekend, but the weather technically is getting warmer, but that second spike potential is on the horizon. So what can you tell us about the short-term and long-term conversations?
Yeah, well, it snowed at my house all day yesterday, so I don't know what's coming next. Apparently, as far as plagues, we have the Mormon crickets making a big comeback in portions of central Utah. So I don't even want to imagine what's coming in July. But back to your first question. So the governor will sit down tomorrow, as he does every week, and review the data across the state. There was a recommendation made from the commission that really wasn't covered correctly. The commission recommendation was to go to green, but there were a whole bunch of caveats around that the media really didn't spend nearly enough time on. And because of the spike that we've seen this past week, the governor wisely said, hey, we've got to see kind of what is the top of this spike. Let's make sure we know what's happening out there. Again, urging people to be careful, but still engaging as much as we possibly can in the economy. And again, kudos to everyone who has done such a tremendous job of this. By the way, if you missed it, a new report that I just saw this morning that said that the Wasatch Front metro area, so basically Ogden to Spanish Fork, had was the best performing metro region in the country as far as employment goes, a full point better than the Dallas metro area, which was second. So it wasn't just that we were best in the country; we were best by a significant margin. And so that again speaks to everyone on this call and the great work that's been done there. However, because of what we're seeing with this spike, the decision is made not to go to green. Again, the governor will review all of that data everywhere in the state. What we're mostly wanting to avoid is sliding back, right? That's so key right now, and so we'll be watching that very, very carefully. And we just need everyone to do their part to make sure that we don't slide back. As far as long term goes, we are concerned. The experts are all really concerned about what fall will look like. And so we're learning a lot about this virus. We're learning a lot about our ability to protect those that are the most vulnerable, our ability to prevent the spread. And it's putting a lot of pressure right now on our local health departments, the spike that we're seeing now. Really, I think what looks different in the fall is school and going back to school. And so we had conversations just today. Our school districts are working hard to look at different scenarios, what that could look like. Everyone agrees that we need to get kids back in school. And we had a meeting with the vice president and Secretary DeVos and others who are working on this at the federal level on ways to get kids back to school, keep them safe. We know that being 6 feet apart is impossible in our classrooms right now. And but we at the same time, we're not sure. There's new data out there on what kind of vectors kids actually make. We know they get the disease. We know it doesn't hurt them nearly as much. We just don't see, mortality rates are incredibly low, which is all good news. But the last question that we've got to answer is, are they good at passing it on to parents or grandparents or others, where they could, it could lead to a significant loss of life or hospitalization? If the answer to that is no, then that certainly makes it easier going back. And so we're very hopeful that over the next 2 months we'll get more data back as research is studying what kind of vectors these kids are making. But we are preparing. We are stockpiling our PPE and making sure that we have at least 2 months of PPE on hand at all times, so that if there is a spike, we're prepared for that. We of course have surge capacity in our hospitals. We have surge capacity with our ventilators. We have surge capacity in the ICUs. We hope we never have to use it, but we have it there in case there is a spike.
Terrific, thanks.
Lieutenant Governor, we've talked about hot spots. Can you kind of explain to us the state's response to some of those areas? And I'll use the example of the meatpacking plant that was discovered in Cache County. What is the response to that? What's the state doing to tackle those hot spots?
Yeah, thank you. So our response is we want to support local health, and again, I just can't say enough good. We give a lot of shout outs and we talk about our frontline healthcare workers, and we should. They absolutely deserve it. Our doctors, our nurses, everyone has just been incredible. But we don't say nearly enough about our local health departments, and most people in the state didn't even know there was such a thing as a local health department, and they've been terribly underfunded and understaffed for years, and now they're the most important thing we have to fight this virus. So what we're trying to do at the state level is really support our local health departments, and what that means is when we have these hot spots, we immediately roll out our mobile testing sites, and that allows us to add testing in whether it's neighborhoods or businesses, so that we can test and test and test, get those results back very quickly. Of course, quarantine, we're helping with contact tracing. And the big area right now, and we're grateful to the president who extended our ability to have the National Guard engaged in these efforts. And really, where we're using the National Guard most right now, 3 areas. One is testing and mobile testing. 2 is contact tracing. They're deeply engaged in helping us on that end. And then 3rd is translation and reaching out to our multicultural communities. So basically, to your specific question, that's exactly what we're doing at the meat packing plant. The Bear River Health Department doesn't have the ability to run tests. They do have multiple disease investigation teams locally and from around the state, and again, we're working with them on the contact tracing. So we're the investigators have been recruited through the Utah National Guard, local health departments throughout the state, and we also have a team from the Centers for Disease Control and Prevention, and the CDC team has also been dispatched to the Bear River Health Department to provide technical assistance, industry assistance, and investigation support. So those are some of the things that we're doing when we see a hotspot, and we've done that in zip codes, neighborhoods, and of course in industry areas that are being hard hit.
Lieutenant Governor, Utah is unique for many reasons, but a couple of them revolve around the CARES Act. In many states, cities and counties are not receiving CARES Act dollars because the state is keeping it at the state level. In Utah, much to the credit of both the executive and legislative branches, money is flowing this week to cities and counties around the state to help offset the necessary expenditures related to COVID. Likewise, we've had a focus in Utah of both physical health and economic health. So whereas a lot of other states were caught flat-footed, Utah has been trying to chart a path for both. As cities and counties are receiving these CARES Act dollars, many of them have been contacting the League and UAC, wanting to talk about economic development and revitalization, but also wanting to ensure coordination with state leaders around economic revitalization. So what recommendations do you have for city and county leaders? Is there both utilizing CARES dollars as well as their own tax dollars to assist businesses to make sure that it's a coordinated effort with the state?
Yeah, thank you. So this is a great question, and one I need to spend a little more time with the Governor's Office of Management and Budget on. Again, I know you just talked to legislative leadership, but first of all, let me say this is really important to me personally, but to the governor as well, that we made sure that we were getting funds out to our local officials to help in this effort. It's just really matters, and I think is illustrative of the way that we do things here in Utah. I do think it's important that we use these dollars wisely, and maybe something we could do is kind of share. We have some data coming out of the Department of Workforce Services about where the unemployment really is and who's being impacted the most, and even some preliminary numbers about industries that may be coming back a lot quicker. And to me, it's been so important to focus on keeping things open, right? I mean, making sure that people have a job to go back to. When the good news is about 70% of the people in Utah have been furloughed, which means that they technically have a job to go back to. But if those jobs go away, then employees don't have a place to go. And so my focus has always been on that. How do we keep the lights on? How do we help these businesses just stay afloat so that they can get back to work and bring the people off of unemployment and back to them? That's how our economy recovers the most quickly. And so it may be helpful, until we have and I should also add, by the way, that our economic task force is working on the next version, 4.0 of the Utah Leads Together plan, and there will be a big piece of that is economic in nature and looking at that recovery, and the data in that I think will be very helpful to the municipalities. And so I think that's coming out next week, So as you're getting that money, I would look for that report. I have not seen the updated version. I've been involved in some of the discussion, but and they're putting the finishing touches on that. So I think in the next few days we'll have more to say on that. But being strategic about it and making sure that we're targeting it at those industries that will give us the best return and by return I mean get the most people back to work.
Terrific, thank you. And we have time for one more question, so I'll let Brandy bring us home. But thank you again, Lieutenant Governor, for all of your time, not just today, but over the last few months. And we'll keep the conversation going, albeit not on a weekly basis in the months to come, but certainly as things arise and as other issues arise, and certainly there are plenty of issues to discuss. But for now, Brandy, I'll let you ask the final question of the Lieutenant Governor.
Thank you, Cameron. And I want to echo what Cameron was saying as it relates to Utah and how we've interacted at different levels of government within the state. Earlier today, I was on a phone call with my colleagues from around the country, and I listened to the stories that they talk about, whether it's coordination with their municipality association or interaction with their governor's office or legislative leadership. And I feel grateful to have the relationship that we do and the interaction we do. We don't always see eye to eye. We certainly each have our own perspectives, but I am grateful for the relationships that we do have and the ability to come together and find solutions. But final thing I want to hit on, Lieutenant Governor, is high-risk individuals. The commission has been talking about as we go through the different phases and the different colors, we're now looking again at the language to make sure that we're emphasizing those high-risk individuals. And it doesn't, as we transition from orange to yellow or yellow to green, we continually need to bring awareness to the high-risk individuals that they don't necessarily move into those same areas. And we each are responsible for our own well-being and need to be mindful if we're at risk for different things. Can you tell us what the state is doing in addition as we emphasize that population more, and if there's anything that our members can be doing to support that effort and sharing that information in their communities?
Yeah, Brandy, if there was one thing we could do, it would be this. In a perfect world, we could protect those groups and then everybody else could do their thing and we would be fine. Now, unfortunately, we don't live in that world. I was just looking at some really troubling data, out of Sweden. And by the way, this was their approach, right? They didn't shut anything down. They were working towards herd immunity, and the idea was just protecting the most vulnerable. And it turns out they've done a pretty terrible job of it. They're seeing huge increases in deaths all over, but especially those in long-term care facilities. And so it's a lot harder than it sounds. And we're going to have to really work together to protect these vulnerable populations. And again, those vulnerable populations are going to have to take steps to protect themselves. For every year you are over the age of 65, your odds of hospitalization and death go up significantly. If you're over 70, you really, really should be careful and not going out. And you may say, well, I don't care, I'll go to the hospital or whatever, but that's a hospital bed that somebody else doesn't get. That's a ventilator that potentially somebody else doesn't get. It's a real burden on the system. And of course, we want people to be safe and to stay alive. And so the biggest area right now is long-term care facilities. About half the deaths that we've seen in the state have been from our LTCs. We have hundreds of them here in the state, and it's so hard. So what we are doing now is we are testing every staff member and every resident of a long-term care facility. Again, the National Guard is helping us with that. We're hoping to have that completed, I think, by the end of next week, and then of course isolating any of those that test positive. And so that's what we're trying to do now. One of the reasons that people in those categories feel like maybe they can't, stay home is because they don't have someone to care for them. They're going to need help. They're going to need people to help with groceries or just to check on them. And this is where neighbors and nonprofits and faith-based organizations can really step up and help out. And so again, whatever your sphere of influence, if you can if you can do something in your neighborhood or your town or your county to make sure that we are taking care of people that are most at risk. And again, not just those over the age of 65, but those with diabetes or cardiovascular disease or other diseases that put them at high risk, morbid obesity with a BMI over 40. All of those people are the ones that we're most worried about right now, and that this disease is attacking. And so anything you can do to help us keep them safe, and we're continuing to add to and revise those plans to protect those individuals. So thank you.
Thank you, Lieutenant Governor.
All right. Well, again, thanks for letting me join. Let's keep these conversations happening. I certainly hope that in the coming months we'll be able to talk about things other than the coronavirus. I don't know what I'll be doing after January, but if I'm still around, we'll keep these calls going. And if not, I may need a job with one of you guys. So don't forget about me. Thanks. Thanks, everyone.
Perfect. Thank you, Lieutenant Governor. We'll be in touch.
Thanks, Cam.
Yep. Thanks, Brandy. See you, everybody. Thanks for joining us again.